Venture into the frontiers of healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, Data First, AI Later, is building a strong foundation for ethical and impactful healthcare solutions. Experience the collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.
Hello everybody, and welcome to another interview for the Data First, AI Later. This is a newsletter for the Health Data Forum. We are so pleased to have here with us Dr. Lynn Farah. She's working at the DNS, French Ministry of Health. And I'm sure that there will be no better person to explain who is Lynn Farah than herself. So Lynn, can you briefly introduce yourself to our viewers and explain a little bit about the amazing work I know you do in the Ministry of Healthcare in France?
Hello, Paul. Hello, everyone. Thank you very much for the invitation. Let me introduce quickly myself very briefly, just to let you have some information. So I'm a pharmacist by training, and I'm also a health economist. I hold a PhD in artificial intelligence in healthcare and founded dedicated to health economic evaluation of artificial intelligence versus robotics. I'm currently a director of digital health program in France, overseeing some key initiatives in health, more specifically in digital and mental health and digital and aging well. And I'm also lead of the artificial intelligence strategy, and some initiatives dedicated to artificial intelligence in healthcare within the digital health delegation of the French Ministry of Health. My work focuses on driving also artificial intelligence adoption in healthcare while ensuring regulatory compliance, ethical governance, and I would say sustainable innovation.
Lynn, thank you so much for your time with us here today. It's really great to have such an amount of expertise in this table. And I'm wondering, to start, if you could highlight a little bit How do you think the data first, AI later movement and the statement of the position correlates to the work you do?
Thank you very much for the question. I would say that there's a synergy between artificial intelligence and health data. So, health data is part of data, and I would say of these data first initiatives, and it's really pivotal in the transformation of healthcare. And artificial intelligence application in healthcare rely heavily on the ability and the quality of health data to, I would say, develop accurate and effective models. So currently in France, we are also working on a national strategy on health data, which will help the development of new artificial intelligence and uses for health data. And we are seeking applications such as AI in clinical trials or the creation of national digital twins to help us with the data to analyze our national health political strategy. So, maybe in one sentence, I would say that by leveraging some extensive health data sets, artificial intelligence can facilitate the design of maybe innovative clinical trial protocol, leading to some more efficient or personalized therapeutics and strategies. So there's a huge link, I would say, between the actual work in the French Ministry of Health and I would say also in the strategy of data first and AI later.
Fantastic, fantastic. It's that makes my day, Lynn. You cannot imagine. But it's interesting because you talked about the digital twins, and this is a concept that still for many people it's not so perceptible. People do not understand really what's digital twins and the implications of having those as a strategy.
Yeah, absolutely. So, in fact, I would say that digital twins and the definition of digital twins can depend also on the person explaining what is digital twins. But at the first step, or maybe on a first application of what are these digital twins, they are based on the use of a huge amount of data, and more specifically in healthcare, the use of health data to represent, in a way, it's a modelization, in fact, a virtual modelization of a physical system, a process, or an object. So in healthcare, a digital twin can be like a real-time digital model for individual patient, for instance. So they can simulate a health status, physiological responses or disease progression. And we have other type of digital twins on a process level for the to help the national level on the health data policy, on the health policy for crisis, for instance, and which allows clinicians and researchers to test different type of scenarios. So it combines data for medical records, for instance, imaging, wearable devices, and some algorithms with or without artificial intelligence to create some evolving models either for a person's health or a state of or a region and the decisions that we could take in a region.
That's fantastic. So you can actually imagine a region with certain factors of disease and certain health determinants, and you can model these variables in order to make a decision concerning what will be the implications of this policy versus this other policy.
Absolutely, it's more and more appropriate with the concept of One Health, with several type of environmental factors, but also on animal, with the animals and the implication on the link between the evolution of some disease and epidemiologic disease, as we have seen in the last years. So it's being more and more difficult also to predict and to prevent some of this disease, and having the ability and the capability to integrate all these factors in a model, a huge modelization system, such as digital twins, could be really interesting for some application, as I said, in prevention, for instance, or in the diagnosis to have a more personalized treatment, for instance.
Fantastic. This is interesting. I'm really curious to learn more about this from you. But as we prepared this interview before, Lynn, we also talked about the ethical considerations and the ethical guidelines for research in this area, right? Can you expand a little bit on that?
Yeah, absolutely. So, in fact, we were talking about the ethical implications, but it's also part of the regulation and privacy. So, including data privacy and artificial intelligence and the data regulation. And ethical is part of both regulation in Europe, either the Artificial Intelligence Act and also the European Health Data Space. And in this, and to this end, France has also been among the first countries to incorporate such questions and regulation in digital in healthcare, including the importance of this data governance and privacy protection and ethical parts. And concerning this ethical the parts, I would say that the Ministry of Health has implemented an ethic by design approach. So we have published documents on this ethic by design, more specifically to ensure artificial intelligence solutions adhere to 5 key principles that are also 5 key principles that are used for the digital in healthcare in general. So the first principle is on the beneficiency. This beneficiency is to improve patients' outcome. When we want also the solution to respect this ethical principle, there's a non-maleficence to prevent some bias with algorithmic bias. When we use also some data, they have to be representative for a whole population, a part of the population. The third principle is on autonomy. We have to ensure the patient control over the decision of these digital tools, such as artificial intelligence tools, but also algorithm tools. And this part is really important, and we have a focus on it on the AI Act, for instance, and the importance of the human control. The fourth concept and principle is on justice and equity. That means also to guarantee a fair access to this digital and AI-driven healthcare using data to have an access to the healthcare system, to the healthcare professional, and having more coordination between healthcare professional, patients, and users. And the fifth one is on sustainability. So we also included in these ethical guidelines the importance of reducing the environmental footprint of this solution, more particularly artificial intelligence solution in healthcare, but not only.
That's amazing. I'm delighted that you are sharing this with us because I'm sure many of our viewers are taking notes right now on these principles, ethical by design. I like that. It reminded me just recently in Paris, the Vice President of the United States was there also in AI summit in Paris, and obviously he has a different view that ethical by design could be stalling the value of innovation and the value of having innovation served first rather than later, right? So are you concerned that ethical by design approach could actually be stalling innovation and preventing patients to have the best benefits of the technology faster?
I think it depends. on the point of view, but also on the point of adoption of the technology. Because the main challenges that we are also now tackling is that for artificial intelligence-based solution and digital solution, at the end, we can develop solution without adoption at the level that we are waiting for it. And the point of adoption of the solution at the end and using the solution is maybe the most important one, because if a solution and an innovation is designed, but at the end not used by the end user, we will not have access to the technology, and the technology will remain, in fact, not really interesting and used. So if we go from the user's point of view and on the adoption point of view, we can also see that it's not just slowing down innovation, that if we keep ethical by design, because it also give a sort of label that solutions that are developed with an ethical approach can also be more reliable. And confidence in artificial intelligence solution in healthcare, digital solution in healthcare, and the data sets that are used and that are created and designed in an ethical way to be used in health digital solutions are also a point that would help innovation, and maybe not limit innovation, but raise innovation to another level. And a solution and an innovation designed in an ethical way could be also part of a more important adoption strategy. So it can shape a new responsible AI and trustworthy AI solutions to help the end users to be using this solution in a more responsible and confident way. So we can have the two point of view, but we are seeing right now and nowadays that the adoption is something which is really vital if we want to then have access to this solution. And to have this adoption, we should have confidence in the solutions that we are using.
That's interesting. That's an amazing perspective, Lynn. Thank you for this, because what we are sensing here is that if you want to be successful with AI, AI needs to be used and adopted, right? But if you don't have an ethical by design approach in the creation of your AI solutions, then the risk is that it won't be used with confidence.
Absolutely.
So that's interesting, because this is there's a Chinese saying that if you want to go far, you have to go slow, right? And maybe this is what
I think
we
it's
are talking all about here, right?
really appropriate. And maybe we can go slow in the first steps, but when we have a process which is designed and reproducible and standardized for all the healthcare stakeholders, we can also then be faster with an ethical approach. So it will be a step-by-step approach.
Absolutely. And we talked about also about the way your health data infrastructure in France is built, and is that an enabler for this innovation strategy you have under health data and AI? Lynn, can you expand a little bit more on the health data infrastructure you are trying to build in France?
Absolutely. I think that we had in France really interesting infrastructure of health data at the national level for data related to medical technique data. It's on really representative of the national population, on the whole population, which is approximately the whole population. So it's our first base. And we also have our national health data hub, which is organized and organizing what we call data challenges to implement some repository to be able, in fact, to let the stakeholders use some of this data to create some algorithm or solutions to answer our need, and more specifically health need of the population on several thematics. On the other side, we are also implementing and helping on the would say on the regional level our university hospitals to have some financement to be able to create or to growth, if it's already created, some health data repository that they have. So it's a national strategy deployed in the main university hospital to help them having the opportunity also to standardize their approach to the creation and the labeling of health data. And I think also it's really important to be able to have a sustainable and a national health data system and access to this health data. And we are creating a national strategy, which is the application also of the European health data space, in order to be able to first structure the data, then having access to the data with a structured process, and also to create some solution which are more specifically dedicated also to the French population if it's needed sometimes.
That's interesting. And tell me a little bit more about the challenges of having public and private and even not-for-profit sector sharing this data on this common infrastructure. Is this really happening?
So, in fact, depending on the type of structure, to have access to the data, they have to answer some questionnaires dedicated to ask for access for the data. It could be at the national level, and it could also be at the local level to have access to this data. And this data is accessible for a researcher in a national research structure, for instance, if the objective of and the finality of the use of this health data is clearly mentioned to have to propose some strategic, for instance, on public health integration, public health analysis on epidemiology, or to have also a more specific overview of the patient pathway in some indication and strategies. These are some of the indication which can help having access to this on the public sector. On the private sector, there are also specific formularies to be completed to ask for the access if the final objective is a non-profit objective and it's helping also the healthcare ecosystem. So it's really well structured and also regulated. So not everyone have access to this data. It's well protected, but when they have it, it should be for a medical or health, public health reason.
So, but how about private use, secondary use of health data? Is this also allowed for companies that want to research on their technologies?
For the secondary use, if the companies want to use it, it couldn't be for the used on a profit strategies. That means that it should be on a non-profit objective for public health. So they can't use it if they wanted to use it for a marketing purpose, for instance, commercial purpose. It's absolutely forbidden. It could only be in research and public health research overview with a protocol which should be submitted, and then the protocol is analyzed and see if it's answer the objectives and the limits and something which is forbidden or accepted. So it's something that is really regulated and under several conditions.
Okay, but so as I assume for the real world evidence research, then it's allowed, right? For any research that brings certainty in the science that we are applying, that will be allowed, correct?
And yes, absolutely.
Yes, because then that will inform better policy making on the use of certain drugs or therapies that we are using, right?
Yes,
Making sure that they are effective.
for this purpose, to analyze the burden of some disease, the consequences of the use of new technologies or products, health products, it has to go through the process, and at the end, it could be accepted if it answers all the cases.
It's good because then we'll be learning with what we are doing, right? And this is so important to have access to this health data infrastructure and anything. We are fast approaching the end of our interview, Irlene. It was really great to talk to you, but I don't want to finish this conversation without perhaps asking you a little bit on the innovation structure and innovation strategies that your country is following. Can you expand a little bit on that?
Yes, absolutely. So thank you for the question. In fact, we are going through substantial investments for this strategy that we called our in France, dedicated to digital health. It's a digital health acceleration strategy, and it's under our France 2030. And there are major initiatives to help, even for instance, for prevention and early diagnosis. We are financing on the total, right now we have financed more than 500 million euros dedicated to this innovation strategy in digital health, and it includes prevention for early diagnosis. For instance, the deep project, it's a project with an AI powered connected medical devices for early metabolic disease detection. We also have the support of digital in clinical decision supports. We have a part of the project dedicated for some collaborative platforms. For this platform, there is a patient-centered approach with a remote monitoring, being able to integrate these remote monitoring devices to track chronic disease patients. And this project also demonstrate how AI, digital, and data are transforming our healthcare sector, improving patient safety. On another level, we are working on economic models for the integration of these solutions. It's also important for us to be able with this project to generate data, and this generation of robust and methodologic data are very important for the financial decider at the end. So it's an aid for decision, helping constructing some economic models for a viable use and the adoption of the technology adoptions that we were talking about. And we have this national also evaluation framework for digital solutions such as digital therapies, the digital follow-up with digital solutions. We have also a huge, as that I've designed just before, the ethical approach of our solutions that are part of this strategy to have a sustainable digital and AI development. And this strategy also includes a part on, so I've designed on innovation and helping innovation on data. And this part on data, as I said, help us also to structure data on a more local level. So innovation in the development of new solution, innovation on the way that we are structuring data in France at a local and regional and national level, but innovation also in the way of designing this generation of data to be able then to have some innovation strategies to finance these solutions. And at the end, innovation in the creation of new pathways to integrate this solution and to have some management innovation in the management of some healthcare sectors by using this new strategy, this new data to leverage also the capability of our healthcare professionals, of our patients to be able to use their data, like it's what we say the empowerment by this data and these technologies to be able to let them have more and more access and autonomy in the way they are also seeing their pathway and their healthcare pathway.
That's interesting because this is placing healthcare in the 21st century in a levels that were beyond imagination just a century ago, right? We can only imagine what will be the health outcomes on these. And before we go, Lynn, there's a question I normally like to ask all my guests: is that if you had a magic wand and you can take one wish, what will be that wish you would take?
It's a good question, I would say. There are several answers possible, specifically on the national level. So I will have to prioritize. So it's my daily work to prioritize, but to prioritize one. Maybe I would say that having a focus on the training, on the use of this technology, because we've talked about innovation, about data, about artificial intelligence, about solutions, but when we are at the end with the end users, something which is really important, and it's also part of our innovation strategy, but I think it's important on an international level, is the training on the use of this technology by the patients, by the helpers of the patients, and by the professionals, healthcare professionals, for instance. So I think we should focus also on the training of this innovation, because if we want to talk about changement and management of this changement, we should talk about the training.
Fantastic. Thank you so much, Lynn, for your time here with us today. I think, like most of our viewers, I learned a lot from you, Lynn. Incredible admiration by your work. As Lynn told me in the confidence that she did the speech, the informity, while working, which is amazing, as I have also my PhD, and it was incredible admiration, Lynn, for your work done. And dear viewers, don't forget to subscribe to our channels, Data First AI Later newsletter. This is a global movement that we are starting, and we are very, very pleased to have you as subscribers and endorsers. Today, I was so pleased to understand that Data First AI Later is really the model that Lynn is and DNS, French Minister of Health, is also following, because in the end, that will bring better results. Lynn, thank you so much.
Thank you very much, Paul. Thank you for the invitation, and thank you for the interesting talk.
It was really interesting. Thank you so much. Goodbye for now.
Goodbye.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation at a time.